So I also have the pleasure of being able to introduce our next two speakers, and it is really a pleasure because if you go throughout the world and you try to identify people who are doing and have done innovative, important work in terms of skills training with this population, including controlled studies, including developing standardized interventions. Really, two of the best experts are right here in San Diego, including Tom Patterson and Eric Granholm. So let me just give a brief introduction to Tom. Tom's been on the faculty of the Department of Psychiatry at the University of California in San Diego since 1983. He's been a professor of psychiatry since 1999. And he's a research psychologist for the Veterans Administration Healthcare System of San Diego since 1983. And he's best known for his research on outcomes measurement and psychosocial interventions in two main areas, HIV and AIDS, as well as late-life psychosis, with a particular focus on schizophrenia. Dr. Patterson was the PI on a recently concluded NIMH study on functional adaptation skills training, FAST, for late-life schizophrenia, and he's currently the PI of the Research Methods Core of the Center for Community-Based Research in Older People with Psychosis, which is an NIMH-funded advanced center for innovation in services and intervention research. And this is at UCSD. And in 2006, the FAST study was chosen by SAMHSA for its listing in the National Registry of Evidence-Based Programs and Practices. In 2001, he developed the UCSD Performance-Based Skills Assessment, which has been chosen by the Matrix Initiative as a standard measure of functional capacity for clinical trials. So please welcome Tom Patterson.
Thank you. Well, that was a really great talk. In fact, I think I'm done with mine already because Kim really did a spectacular job of covering the basics of training. And hopefully I'll be able to entertain you a bit more. And one of the things I would like to say right away is some of you here probably have helped in the testing of the interventions that we are talking about now. And I want to thank you all for your help in developing something that I think is really useful and we continue to work on. So, first off, you already know what the learning objectives are. You have them in front of you, but just to remind you what they are, I thought I would provide you with a slide of that. And I'm not going to go through that so that we can move ahead. But I also, one of the things that Kim said is that we need to encourage people to practice skills by first providing evidence that these things are important. And so what I wanted to do first is just give you a little bit of an idea of why we do this. And you can see here that this is an important area that's been recognized since the 1800s. And so we want to try to improve behavior of individuals through a lot of these. I didn't bring a printout, so you're going to have to watch me turn. I know it's not in there because I just finished my talk about an hour ago. So I'm always curious to see what I have to say when I come to speak. One of the more important things that's come out recently that guides where money goes in the government, in funding programs and research and whatnot, comes from the President's Commission on Mental Health. And one of the things that I think is important here is that we need to start to move toward getting people out into the community, and we need to know how to actually measure whether a person's ready to get into the community. So this report really emphasized, from my perspective, these two ideas. Now, one of the more important things that I always emphasize in these talks is the importance of theory. And Kim mentioned briefly theory. The theory that I've used in all of my research, I actually work in a number of areas, and I'm very enamored with social cognitive theory, which has three basic elements. One is knowledge, the other is self-efficacy, the other is outcome expectancy. Knowledge is necessary but not sufficient to change behavior. Self-efficacy means you believe that you can actually perform the behavior. And I'm going to show you how we can improve a patient's ability to, or their self-efficacy to perform behavior. And outcome expectancies mean, yes, I can perform the behavior, but I have to have a positive outcome expectancy. That is, believe that if I'm in the situation, I can actually perform it successfully. And so we try to improve each one of these three basic elements using social cognitive theory. And by doing that, the way you do that is first through observation. So this is where you demonstrate and provide the person with appropriate skills so that they have an idea of what they're supposed to do, and that's role modeling goes on, and that's what we do, and I'm going to go through in a moment our intervention just very briefly. Practice and rehearsal is absolutely pivotal in this. That is, you're not going to get somebody's self-efficacy to improve unless they actually do the behavior. What I'm doing with you right here and now, this is supposed to be a work group, and we're supposed to be talking, communicating. You're not going to learn very well what I have to say until you actually do these behaviors. So that's the key to all of the training that you want to do with patients, is get them to actually practice the behavior. You need, as Kim was emphasizing, positive feedback, and that's absolutely critical. Negative feedback is not going to help at all. It's going to be nothing but destructive. Reinforcing behaviors as they occur to shape them, and developing support systems in the community, in their family, and in their board and care, wherever they are, to practice the behavior. Sometimes, we talk about social support, and we talk about negative support and positive support. Calling it social support suggests that it's always positive, and it isn't. We need to be certain that the kinds of behaviors that the person is trying to practice are supported by the people in their environment and not discouraged. Many times that's what happens in this environment, is somebody's afraid to allow somebody to actually engage in a particular behavior, and they by protecting them, in quotes, they are discouraging the behavior from actually